Hi, I am Dr. Maya Bristow Klein, and I want to address something that is deeply unsettling but crucial to talk about: the recent tragic school shooting in Madison, Wisconsin, committed by a 15-year-old girl. Whenever events like this happen, we hear experts, especially from academia, caution against looking for patterns or behaviors that might help us identify children at risk. As Justin Hines, an associate professor from the University of Michigan, recently said, there is not necessarily a profile. I cannot give you individual characteristics or patterns of behavior that predict with accuracy who might perpetrate an event like this. But I want to offer a different perspective. While academics debate these questions from afar, clinicians, those of us working daily on the front lines with children, know that there are behaviors and patterns to look for. The truth is, this is not a complete mystery. And if we are serious about prevention, we need to take hard, honest looks at the children we are raising and the environments in which they grow. So, what should we pay attention to? Here are some warning signs, keeping in mind that not every aggressive or defiant behavior means that something is wrong, and these behaviors vary with age. In younger children, those between the ages of 3 and 7 years old, look for frequent temper tantrums, defiance, physical aggression, property destruction, and a tendency to provoke others. In middle childhood, that is 8 to 11 years old, this might escalate into lying, stealing, bullying, cruelty to animals, and fire setting. In adolescence, between the ages of 12 and 17 years old, behaviors can become severe, including assault, robbery, vandalism, truancy, a preoccupation with weapons, and substance misuse. We've recently learned that the girl in Madison came from an unstable and turbulent home, a chaotic environment without the consistency, structure, and care that children need to thrive. A home environment like this is a significant risk factor, compounding emotional and psychological challenges and increasing vulnerability to harmful behaviors. While not all children from such backgrounds commit violent acts, the home environment is a crucial factor that must be considered alongside behavioral warning signs. Not every child who shows these behaviors will escalate, but for those with persistent antisocial tendencies, early intervention is key. That intervention requires parents and caregivers to be present, reflective, and intentional and firm, while still empathic. However, addressing these behaviors and understanding their roots requires the expertise of psychologists trained in the diagnosis and treatment of severe personality disorders in children. This is not work for journalists, influencers, or academicians observing from a safe distance. While it is good that these conversations are happening, treatment and expertise are a whole other ballgame, one that takes years of training and clinical expertise to navigate effectively. If you suspect your child could commit such acts based on the behaviors I just shared, please seek help immediately. Early intervention with a qualified psychologist can make all the difference. At Pathformers, we are taking this issue seriously. Soon, we will launch an entire segment dedicated to understanding antisocial personality disorder and other personality disorders in children and teens. This segment will be tailored not just for parents, but also for providers and educators, because it's crucial that everyone, parents, teachers, and mental health professionals, are equipped with the knowledge and tools to identify risk factors, address concerns, and create environments where children can thrive. This work is complex, but it is not hopeless. By addressing these concerns early and comprehensively, we can help children on a healthier, more productive path and maybe even prevent future tragedies.